I will be performing Foley catheter insertion. So to begin, I'm going to go ahead and look at my provider's orders, and I see that Mrs. Charlene Knight has an order for Foley catheter insertion because of urinary retention, and she's been unable to urinate. So now that I've checked that, I'm going to go ahead and talk to the patient. Knock, knock, knock. Hi, Mrs. Knight. My name is Shelby, and I'll be your nurse today. Can you please verify your name and date of birth? Okay, I see Mrs. Knight, 8/8/1939, and I do see that you're allergic to penicillin, latex, and betadine, so we'll make sure that none of that is involved and make sure you're okay with that. But I have heard that you've had problems going to the bathroom and urinating, so the doctor has ordered a Foley catheter for you, so I'm going to go ahead and insert that today. But to begin, I'm going to go ahead and assess the area and make sure that everything's okay and that I can insert the Foley catheter. So I'm going to go ahead and perform hand hygiene and put some gloves on to assess the area. Okay, and I'm going to go ahead and put the height of the bed up right now. That makes it a little bit easier. And put the rail down. And lift up her gown. And to assess, I'm going to visualize the urinary meatus. I'm going to make sure that there's no lesions or discharge that is abnormal, and I do know that the nurse performed pretty okay this morning, so the area does look clean. I'm also going to palpate the bladder, and I do note that there is some distension, but that is because Mrs. Knight hasn't been able to urinate. Okay, Mrs. Knight, I'm going to go ahead and cover you back up, and I'm going to go ahead and get all of these supplies ready, and then I'll be back. So I'm going to come out, take my gloves off, perform hand hygiene again. Now I'm going to go ahead and check my catheter with the provider's orders. I want to verify that what I have here is a 14 French catheter, which does match up with the order. I also want to make sure that what Mrs. Knight is allergic to is not in the catheter, which it's not. So now go ahead and I'm done with my provider's orders. I'm also going to make sure that this catheter is not expired, which it's not, and I would want to check that the catheter is close and intact, which this one has been used for practice, so it's not, but in a real life scenario, I'd make sure that it was intact. So now that I've done that, I'm going to go ahead and take it out, place it on my surface, and I'm going to make sure that I have a clear, dry surface where I'm going to be setting up my sterile technique. I'm going to take the bag and place it at the foot of the bed, so that I can use it later on for ease. And I'm going to go ahead and make sure Mrs. Knight is in the proper position to insert the catheter. So I'm going to lift up her gown, make sure her legs have an adequate area. And I'm going to go ahead and perform hand hygiene as I begin to open this up. I'm going to position this so that it's a little bit easier. And to open it to begin, I'm going to open the first flap away from me. And as I do this, I want to make sure that I'm not reaching over my field ever and that my flaps do not open back over. So then I'm going to do the left field. And again, I'm only touching the 1-inch margin to make sure that it stays sterile. After I do left, I'll do the right one. And then I'm going to grab this last one and open it back. To make sure that these edges aren't everywhere, I'm going to make sure, I always want to keep my sterile field in sight and never turn my back to anything, so I'm going to go ahead and reach around here, 1-inch margins, and make sure that this is correct and that it's not hanging over the edge at all. Okay, so my first thing that I'm going to do is I'm going to grab this blue drape, and I want to make sure that I grab only the shiny side, and I'm just pinching it a little bit, not reaching over my field too much. Pinching within this little margin. Again, only touching the shiny side. And I'm going to go ahead and step back and grasping the 1-inch margins. I'm going to hold this back and I'm going to go ahead and lay it over Mrs. Knight, making sure that I'm not reaching over it. And I'm going to go ahead and lay it down. Now I'm going to go ahead and put some gloves on. So I'm going to grab these gloves and place them over here. Again, not turning my back to my sterile field. Go ahead and open my gloves up, set them out, throw this away in my trash. I'm really going to try and not ever drop my arms below my waist. So I'm going to come over here and open up my gloves. And outside of the package it's not sterile, but as I get closer, I'm going to open from the bottom. And to open it, I'm going to put my hands underneath because this little border is sterile, so I want to make sure I go underneath with my hands. Okay, now that I got that, I'm going to pull it open, making sure it doesn't flap back on me. So to begin, again, my hands never go below my waist. I'm going to take my non-dominant hand and grasp the right glove within the little border. I'm going to pinch it up and bring it up high. And again, this little border is not sterile, so I can go ahead and touch it, reposition it. And I'm going to go ahead and slide my forefingers in correctly and my thumb. Now that one's on. Now to grab my left glove, I'm going to go ahead and take my right hand and I'm going to place it underneath, only my 4 fingers, underneath here. Again, step back, make sure that my hands are above my waist, and I'm going to go ahead, stick my 4 fingers in there, and I'm going to supinate my hand. At least I get this correct. Into this glove. Once I have that in, put my hands together, and I can get rid of this. Okay, again, still facing my sterile field. Next, I'm going to grasp this white drape, open it, step back, because I make sure I don't want to reach over my field. I'm going to open this up and place it over the area. And again, when I place this, I want to make sure I'm not reaching over my other sterile field. Go ahead and place that right there. Okay, now that I've done that, I'm going to come back to my sterile field over here, again, making sure never to turn my back. And I'm going to reposition my box and take the lid off. So first I'm going to take my hydrogen peroxide, open it up, drop it. Again, I want to make sure I'm never putting my hands below my waist. So I'm going to take this hydrogen peroxide and I'm going to pour it over my cotton swabs. Again, when I throw this away, not reaching over or turning my back. Next, I'm going to grab my lube, open this up, pour it in the box, come over here, not turning my back, throw it away. So now I'm going to go ahead and grab my sterile solution, and I see that it is 10 milliliters. Take the lid off, and I'm going to go ahead and reach in for my catheter, and I'm going to check this little green thing that says that this balloon can hold 5 to 10 milliliters, which is what's in my syringe. So I can go ahead, hook that up, place that back in the box. I'm then going to grab my catheter and I'm going to take the sheath off and making sure that the catheter is not touching anything because now that it's sterile, so I want to make sure I'm holding it secure, and I'm going to drop the sheath over here. Okay, I'm then going to take this and I'm going to lube it up in my lube. And I'm going to place it back in the box. I also noticed that there is this medicine cap that I do not need, so I'm going to leave this over here. And again, my hands never going below my waist, never turning my back to either sterile field. But now that I am complete over here, I'm going to go ahead and place this back on here. And I'm going to drop this over on my other sterile field. Again, not reaching over too much. I'm going to place it down. I'm not done with this sterile field, so I'm going to move it out of the way. So to begin, I'm going to take my non-dominant hand, and I am going to contaminate it because I'm going to hold it over here to keep the labia open. So first, I'm going to clean the area, and I'm going to be cleaning from clitoris to anus. So I'll begin with my first one, and I'll be cleaning the outer labia first, clitoris to anus, coming around my field, making sure not to reach over. Then I will take next one and do the inner, coming around, placing it in, coming back again, doing the middle, coming around, throwing it away, making sure not to contaminate anything. Outer again, clitoris to anus, inner, middle. Okay, again, I'm going to keep my non-dominant hand on here the entire time until my sterile procedure is over. Now that I'm done with this, I'm going to move this over here. Again, not turning my back or reaching over my field. So the next thing I'm going to do is I'm going to visualize the meatus, and I'm going to go ahead and grab my catheter. I'm going to hold it 2 to 4 inches back. And I'm making sure not to ever touch it, let it touch anything, or touch the labia to make sure it doesn't get contaminated. So now I'm going to go ahead, and Mrs. Knight, I'm about to insert the catheter, so if you could please bear down with me, and you might feel a little bit of pressure. So I'm going to go ahead, making sure not to touch anything, and go ahead and insert. Making sure not to feel any resistance. And then again, once I start to see some urine, I'm going to go ahead and insert 1 more inch, making sure my hands and my gloves don't touch anything. So now I'm going to go ahead and inflate the balloon. Again, I have my 10 milliliters, and I'm going to insert. Okay, now I'm done with that. So I'm going to go ahead and unhook. I'm going to make sure I'm going to tug, make sure that stays in there, and I'm going to unattach this. Done with this, now I'm going to go ahead and I'm done with my sterile procedure now, so I can take this off. And I'm now going to attach the catheter to her inner leg, and the bifurcation right here, not with tape, but with whatever came in the kit to secure it. I'm then going to lay this down on the side of the bed, and I'm going to hook it to the inside of the bed, not to the rail though, because I know that that will move. I'm now going to make sure that Mrs. Knight tolerated the procedure okay, and I'm going to inform her that I will be back to perform catheter care every shift. And I'm going to document accordingly her input and output and the color of the urine and everything like that. So I can now go ahead and take my gloves off and perform hand hygiene.